Okay, so for this patient, they had a right CVA, so it affected the left side of their body, okay? So this patient's left upper and lower extremity have been affected and they are currently flaccid. One thing we do not want to do, especially with a flaccid upper extremity, is kind of tug on it because that can dislocate or sublux the shoulder, okay? So we want to avoid that. You know, we might have to make adjustments as we are getting these patients to the edge of the bed. Okay, so put my bed rail down. I'm gonna say I'm gonna take down your covers. Is that okay? We'll make sure that you're all covered. Look, you're all dressed underneath here. Somebody from your family came and got you dressed. Okay, so right now she can't use this arm or this leg. One of the things that we can have her do is she can reach this arm over here to the bed rail, okay? She can use this leg to kind of push her over, and we might lower the bed. That way the head of the bed's not elevated, making it difficult for her to roll over, okay? So I wanna be mindful of my body mechanics, but if I'm going to sit her up from this position, I can't have the bed really far up, okay? So we have the bed in the lowest position. So I want you to reach over for here, and I want you to kind of pull yourself over and roll over onto your side, okay? If you can, let's bring your legs up off the bed, okay? And she can't use this other arm, so I'm gonna tell her to push with this arm right here, and we're going to work on getting her into a sitting position, okay? She needed a lot of help with that. Your patients might not need a lot of help. That's why we say, go ahead and do as much as you can, and then we will help you as needed, okay? She has this arm to kind of give her that support. We wanna make sure this arm is supported so she's not getting the subluxing of her shoulder here. And again, if this patient requires a lot of assist, I'm right here to block her leg to make sure she's not going to slide off of the bed, okay? Another way we can get this patient up, if you wouldn't mind lying back down, okay? She's got flaccidity. Sometimes patients want to kind of work their way over to the edge of the bed by themselves. Go ahead and do what you can. And maybe let's get this leg off, okay? Good. And maybe just reach this hand over, see if you can kind of pull yourself over. Okay, good. And then I'm going to push here. Giving a push here to their hip really helps pop them up into this position as well. So that's another good tip for you for whenever you're sitting them up, okay? Keep in mind that this patient is actually moving fairly well, but you might have a patient who's more mod to max assist. Remember that moderate assist is the patient is doing 25 to 75% of that movement, and then the therapist is doing the other half, okay? If this patient got to this position and she required max assist, I would do the same thing, kind of find a good place here, and rather than trying to pull her up like this, I'm actually leaning back with my body weight to kind of counteract that and pull her up to the sitting position.